Until the pandemic came and hit us, I think a lot of people were not quite so aware as to how much our lives are impacted by global events that might start anywhere.
This is a real crisis.
I mean, it's been clear that this was likely to spread in the U.S.
We need to be thinking much more ambitiously.
Climate finance is a very big issue.
We, the Center for Global Development, we're a group that try and see how we can make the international system that supports global development work more effectively.
CGD came about because it was time to focus not only on what developing countries should do, but much more on what the rich world should do.
How do we finance infrastructure in the poorest parts of the world? How do we increase productivity in agriculture? What kind of policy brings out the best outcomes?
Some of our previous work has helped to come up with a kind of innovative financing mechanism that was used to help launch pneumococcal vaccines. We really have researchers and experts here at CGD who come at these issues from multiple vantage points, and I think that's just what helps make our research more rigorous, more rich, and actually more connected to the realities that decision makers are grappling with.
We've been looking to CGD for all of your research and analysis to guide us.
So CGD is nonpartisan. Because of that, over the years, that credibility has given us significant convening power.
Our government highly values the work.
What CGD is about is you can ask those difficult questions that people refuse to ask and actually find solutions.
We're thinking about how climate change will impact migration patterns, how that will in turn have impacts on people's health.
It's challenging to be able to align budget with ambitious programmatic goals, but it can be done.
Every single time that we're able to get it right, it means we're reducing significant poverty.
If you can help to make things a little bit better, that's a good way to spend your time.
Welcome to the Center for Global Development. My name is Javier Guzman. I'm the Director of Global Health Policy and a Senior Fellow here. Today, we're going to approach a very sensitive topic in a new, innovative way. We're going to have a debate on whether patents promote health innovation in low and middle income countries. As you know, patents and innovation have been discussed, and this has been a very hot topic since the World Trade Organization started to implement the TRIPS agreement in the mid-90s. Some argue that patents incentivize research and development for technologies needed around the world, while others argue that IP protections might lead to health innovation in high-income countries, but that doesn't mean lower-income countries benefit from those innovations. So you see, there are many different questions related to patents, but we're going to focus only on one specific question, that is, do patents promote health innovation in low and middle income countries? And we're going to try to focus on the evidence. This conversation, this debate is very important because more and more low and middle income countries are talking about moving towards a knowledge economy. Countries are interested not only in manufacturing products in their territories, but also developing and engaging in an innovation ecosystem to get products that are needed for low and middle income countries. The idea today is not to say, some people are right, some people are wrong. It's more about listening to the different arguments. And for that, I have four stellar panelists. And I'm very, very proud to, have Anita McGahan, who is university professor and George Connell Chair in Organizations and Society at the University of Toronto. Thank you, Anita. We also have Cassandra Sweet, who is a senior consultant at the United Nations. We have Adrian Towse, who is an emeritus director and senior research fellow at the Office of Health Economics. And we have Carlos Correa, who is the executive director of the South Center. So basically, we're going to have, first a poll to see where you all are. And then each of them will have the opportunity to convince us all whether patents do promote or do not promote health innovation in low and middle income countries. So welcome to this debate. And please, let's have the poll. You'll see a QR code on your screen. Please scan the QR code or type in Mentimeter, the number that you see there, and tell us whether you think patents promote health innovation in low and middle income countries or not. I'll give a minute for you all to engage. And after that, we'll start with the debate. Anita will get us started. So QR code or enter the number in the Mentimeter. Let's say 30 seconds more, and we'll see where we are. Okay. Kate, can you please send me the answers? Okay, I think most people say no. I think we've got a 60-40, 60 saying no and 40 saying yes. This is just the beginning. I know more people will engage. Some of you were shy and didn't engage with the poll, but we'll open the floor to Anita, who's gonna give us her arguments to basically say that patents do promote health innovation in low and middle income countries. Anita, over to you, and thank you very much for joining us.
Oh my goodness, it's my honor to be with you today. Thank you so much, Javier, and thanks to all who made this possible. Let me, if I can, try to persuade you that indeed patents do promote health innovation in low and middle income countries. So I'm going to try to persuade you that the answer is yes, but I'm also going to try to explain how patents have had an impact that are not exactly in the ways that were initially envisioned under the TRIPS agreement back when it was written in the 1990s. So the answer here is yes, but not exactly in the ways initially envisioned. So first of all, the motivation here for introducing patents, or what's called harmonizing patents in low and middle income countries through TRIPS, was put forth by the World Trade Organization as encouraging new inventions, such as new drugs, which have these high development costs to benefit people in these countries. And this was immediately controversial. This is a picture from the Seattle City Archive of a protest against what was called global injustice, on the idea that the high prices that come with patents would be unfair in low-income countries. So immediately controversial. In fact, there's a number of things to say about this problem, which is including stuff related to pricing and so on. I'm not going to have time to cover that. What I do want to acknowledge is that there were many studies, especially through about 2013, and some of them authored by me, showing that TRIPS indeed did not lead to new medicines in low and middle income countries. But no new medicines is not the same thing as no new health innovation. We actually are starting to see some substantial evidence of health innovation that's pretty tightly tied to TRIPS implementation or patent implementation in these countries. So the first type of innovation has to do with evidence of more basic science on the so-called neglected diseases that are prevalent in low-income countries that occurred specifically after TRIPS. I've got here a representation of the pharmaceutical development chain, basic science on the left, followed by applied science and clinical trials, then distribution and post-sales analysis. This whole chain can take 11 to 14 years. It can cost more than $1 billion. It's extremely risky, with only 1 in 5,000 chance of success. And the whole thing rests on having the basic science that we need to be able to launch the whole process. And while we see no evidence of new medicines emerging on the right-hand side of this process, we are seeing some new evidence of basic science. And that's coming up in a number of different studies, including quantitative evidence of new R&D and drugs for these non-neglected diseases like cardiovascular disease in low and middle income countries. We're seeing qualitative evidence of the evolution of the scientific community, especially in Brazil, India, and China. We have studies on that. We see significant basic scientific research leading to the registration of new drugs to go into the clinical trial process, new testing, new treatment, new prevention methods. And in fact, with some doctoral students, we've done an instrumented diffs and diffs analysis to make sure that it's associated with TRIPS, and we're finding that evidence. So more basic science, point number one. Point number two, we're seeing a lot of new prevention through innovation, health innovation, and education and public health measures that's implemented after TRIPS. I want to point out that the neglected diseases, which are specifically tied to low and middle income countries, are often infectious, mostly infectious: malaria, tuberculosis, encephalitis, meningitis, and dengue fever. Non-neglected or global diseases, which are prevalent everywhere, including low-income countries, but also they're the primary cause of death in high-income countries, are especially cardiovascular disease and cancer. What we're seeing is prevention through education and public health as especially effective to prevent infection on neglected diseases. And that's health innovation, and that's occurring after TRIPS. The third thing we're seeing is more biopharma activity in these countries after TRIPS. It's often on global diseases. So, for example, in China, we have leadership in regenerative medicine, which is a cancer targeted very frequently, and China becomes a leader in this after TRIPS is implemented. India, investing in process innovation. Brazil, more vaccine research. So lots of exportation of health innovation from low and middle income countries after TRIPS. We're also seeing more citations to publications and patents that are, more citations in publications and patents anywhere to science that's produced in low and middle income countries after TRIPS. This is a chart from a paper that I've just done with two colleagues that shows this. And then the fifth explanation is that we're seeing more healthcare institutions in these countries after TRIPS, including more clinics and hospitals, medical schools, funding, lab space, collaboration between South and North authors, and so on. There's a long list here. So the bottom line is the answer is yes. In these well-identified studies, we are seeing more evidence, increasing evidence of health innovation in low and middle income countries after patents are protected in these 5 different areas. Let me stop sharing and turn this over to Cassandra to offer an alternative perspective. Thank you.
Good morning, and thank you so much, Anita, for sharing your ideas with me and with everyone on this call, and for the Center for Global Development for creating this framework. It's so exciting to get to share some ideas in a little bit of a different format. So I think I have a slideshow that was going to be shown. There it is. And so we're looking at this question: do patents promote health innovation in low and middle income countries? And again, my honor to share with you. A lot of my views on innovation are based on some of the research that I've done over the last 10 years on the sort of quantitative empirical side. And what's sort of funny is that Anita and I have a lot of overlapping views on innovation, although we're taking different positions in it today, in the sense that I am arguing that no, patents have not generated, have not incentivized innovative output in developing countries in the wake of TRIPS and TRIPS Plus. So we're going to go at it from different angles, but what are patents? These are rights, monopolistic rights that are guaranteed by the state and national level. And they are all these exclusive rights, right? We grant innovators this bargain, this capacity to protect their ideas, and we as a society reap the rewards of those ideas. So next slide, please. And over time, we've seen the way in which we regulate these ideas, what we call in the literature, harmonize, increase, and become sort of narrower in their breadth. And this is how we're understanding, for many in innovation literatures, what innovation is, right? Is innovative output the classic standard, the most sort of originally cited in some ways through Gennardet and Park and their indicator of patent rights, is looking at patents as this sort of output piece in the innovation puzzle that represents success. So I want to agree with Anita here to say, What is innovative? Is it just patents that are innovative, or are there other pieces in the innovative system that show us increased innovative output? If we're just looking at patents, I believe that there's a fairly strong empirical evidence, although I'm sure the other speakers, with all the vast experience they have, can point to specific indicators of perhaps projects or spillovers or investment, in particular in the larger, attractive developing countries like India, Brazil, and China. But for the vast majority of developing countries, these new patent systems, if we're just looking at the output indicator of number of patents given, I think that there is some strong evidence out there that it has not resulted in local innovators applying for or receiving higher levels of patents. So for example, this is one new study in research policy that's just come out from a really great econometrician, Valeria Arza, led this study. And what she shows, looking across Latin America, is that the number of patent applications given and granted to residents versus non-residents has stayed quite stable. For residents in some levels has also dropped while it's increased. So more non-residents are using these new patent systems, for example, in Latin America. And if that is not evidence that that sort of innovation is being driven externally, it certainly is, if not conclusive, it certainly is one piece of the puzzle in understanding who and how these new patent systems are being utilized in developing countries. Next slide, please. So yes, there are all these other inputs and outputs in innovation systems. Perhaps we don't want to just look at patents as an indicator. It's all a part of how ideas are generated, how products are registered, and how they are brought to market. And just like Anita, I also am very concerned about basic science, but don't have quite as sanguine a view about the activities that have been going on in developing countries. I see a picture where at a fiscal level, governments are very compressed. I see a reduction in science spending, in particular in the area that I look at in Latin America, in many key countries, as inflation has had a real impact. And at the base level here, this is a lovely little paper. I think, unfortunately, it's just available in Spanish, Innovación y Propiedad Intelectual in Latin America and its impact on medicines. And in it, Martinez, Pivas, y Tripo really show the weakness, the enduring weakness of the innovative system in Latin America. And you see this in terms of, for example, this is a study on the last few years in Central America of looking at the number of folks with PhDs in the science areas. It's remained quite stable and very, very low. All right, next slide, please. So really, what are the choices for policymakers as we move forward? The patent system is one element of innovative output in the region, and we certainly have seen, across multiple dimensions of Latin America and globally, increased innovative efforts. Is that a result of patent systems? When I hear Anita describe all of these wonderful things that's going on, like more patent research in Brazil, more citations and publications, more institutions, these three items are noted as things that have occurred in the wake of TRIPS. Where's the causal relationship? Are these things really a result of TRIPS? If anything, I would say TRIPS has been one of the variables that states in developing countries have to deal with as they try to create accessibility of innovative products to their people. And I believe two main ideas have come out of these last few years. And again, I speak as a consultant to the United Nations, as someone engaged in these policy questions in Latin America. And I think that two basic ideas are that, one, if innovation is the goal, then the definition goes much beyond the patent system itself, which can be a burden and can be an incentive and also can be a blockade. And number two, there are other interlocking systems that actually have a great impact on the accessibility piece, the accessibility of the innovation in Latin America. And I just want to briefly mention one of them, generics. Next slide, please. because really it's very hard for governments in Latin America to invest in innovation systems, and in particular in the healthcare sector, when they're really struggling with sort of balance of payment issues, price and purchasing changes that are quite radical, supply chain issues that really create great difficulties at the national level for supply of basic inputs. I want to share with you this graph just to show how astounding some of these price differences can be. Thank you so much. I'm going to close down Javier in just 1 second if I can. You can see that in Bolivia, how much more expensive the per unit medicine is versus other countries in the region. Next slide, and I will close up. So yes, patents are a key piece in this story, but they in no way are the reason for increased innovation output. And there's a lot of evidence that they're not being used by local innovators and by local governments that are facing very difficult decisions in this current landscape. Thank you.
Person defending the yes, one person defending the no. Now it's time for Adrian to take us back to the yes position. So Adrian Towse, please, you've got your 6 minutes. Over to you.
Thank you very much, Javier. So I want to argue that patents, and here I'm including all forms of intellectual property protection, are the best tool we have to get the innovative drugs, vaccines, diagnostics we want to improve the health of the majority of the world's populations who live in low and middle income countries. And we'll come back to ultimately that will lead to more investment in low and middle income countries. I'm immediately going to concede there are problems with patents. I will paraphrase Winston Churchill's famous quote about democracy. Patents may be one of the worst ways to get new health technologies we need, except in comparison to all the other ways that we know about. So my 2 points are that in thinking about evidence, what's the counterfactual? If we have evidence of effect or not, what are we comparing it with? And secondly, that patents need to be used within a framework of other measures to deliver efficiently, both getting access to new current innovations, but also the innovations of the future. And I think that's very important in the context of the comments in particular that Cassandra was making. So more specifically, I want to argue that alongside patents, in order to get the investment, both in access to new products and local investment, we need more money in universal health coverage, together with improved procurement. A Center for Global Development did a great report on this 2019, tackling the triple transition in global health procurement, that showed, amongst others, the challenges of getting post-patent efficient competition. And I've previously done work with Patricia Danson that suggests the importance of trying to use the most globally efficient suppliers, most of whom are in middle income countries. Secondly, continued donor funding of the key global buyers of drugs and vaccines, notably Gavi and the Global Fund. Those are incredibly important in making new technologies available in middle and low income countries. And thirdly, the need for pull incentives to incentivize the private sector, whether in middle income countries or elsewhere. And we've seen the example of pneumococcal vaccine advanced market commitment, some of the advanced purchase commitments we saw during COVID, the Gavi COVAX scheme. And we have clear evidence from Michael Kramer, the Nobel economics laureate, on the benefits of these types of advanced market pull mechanisms in order to generate benefits. And again, Center for Global Development has a recent report by Rachel Silverman Bonifield, Operation Warp Speed on Core, which reviews the success of Operation Warp Speed and its potential application in other technologies. And in an earlier Center for Global Development paper that I co-wrote with my OHE colleagues and with Rachel and Calypso Chalkidu, funded by the Bill and Melinda Gates Foundation, we looked at evidence in the TB space and proposed a market-driven, value-based advanced commitment, which we called MVAC, for new TB drugs, aimed primarily at middle-income countries, but also with access for low-income countries. And of course, we need continued push funding for the early stages of R&D, with pull incentives picking up at a later stage. I would highlight the 2021 PATH report, Keeping the Promise, which highlighted 66 new health technologies which had reached more than 2.4 billion people since product development partnerships were initiated. Now, of course, many of these successes did not involve patents from the R&D-based industry, but many did. And it's worth reminding ourselves, while we have patent protection, it provides financial incentives. There's a classic 2004 paper, Acemoglu and Lin, which uses empirical evidence to find that firms do respond to market share, and the profit incentive is related to the size of the demand. It's what economists call dynamic efficiency. Market signals from the healthcare system stimulate investment to meet the future needs of patients. And of course, the key point is that the costs of failures are borne by private investors. So my final, as I sort of move to my sort of close, is just to talk about dynamic efficiency. I've talked about, but we also have static efficiency, getting the best use of what we have. And patents mean prices above manufacturing and distribution costs during the patented period as innovators try to get a return. That's going to be too high for some healthcare systems. It'll take money away from other treatments, but differential pricing can avoid this. It's efficient for society, and for profit maximizing for companies to use tiered or differential pricing. So low-income countries pay prices that equate to manufacturing and distribution costs. In the paper I referenced earlier, we use Clinton Foundation data to show that differential pricing has been taking place, with low-income countries getting lower prices than middle income prices. So I'm going to add differential pricing to the list of things we need to focus on rather than patents on their own. So in summary, what we need in order to get better global health is to keep patents, invest in universal health coverage and global procurement institutions, and more pull incentives along the lines of the advanced market commitment for pneumococcal vaccine, continued push funding of early stage R&D, and differential pricing to increase access to existing technologies. If we create that sort of environment, then those middle and low income countries who have a degree of competitiveness and potential competitiveness in science-based biomedical pharmaceutical industry will be able to take advantage of patents and produce the health gain, the products that will deliver the health gain that their populations need. Thank you.
Thank you very much, Adrian. Last but not least, we've got Carlos Correa. He was having problems with his internet connection. Let's see whether he's back with us. Carlos?
Yeah. Can you hear me?
Over to you. Yes, we can hear you perfectly. Over to you.
Okay, well, thank you very much, Javier, for the invitation to discuss this very important issue. I appreciate very much the presentations made.
Carlos, we can hear you, but we cannot see you.
Yeah, I don't know why. Because no, it is on. The camera is on.
Okay, well, please, it's okay. Yeah. Please continue. Please continue. We can hear you perfectly.
Yeah. So, Javier, when you introduced these debates, you mentioned that they should be based on evidence. And I appreciate what Cassandra has already presented. She has presented evidence. I'm sorry to say that what was intended to be an evidence presented by Anita does not show anything in terms of the question that you have raised. Patents are not there to promote basic science, so basic science are not promoted by patents. Basic science generally produce outputs which are openly available. Education after TRIPS, so the argument that education after TRIPS has increased, so it's very difficult to establish a relationship. What has TRIPS or the patent system has to do with education or prevention, as was mentioned. So I think that these arguments are very weak indeed, and also I appreciate very much the work that Adrian has made over the years in pharmaceuticals, but certainly I think he has not replied your question whether patents actually promote health innovation, in particular medicines, in low and middle income countries. So he has referred to price discrimination or to advanced purchasing, but really no evidence is provided. I think the best evidence that you can look at is just look at the research and development in the area of pharmaceuticals in particular, in developing countries, and what outcomes can be seen, and in particular, whether they are related or not to patent protection. Then if you look at the global scenario for developing countries, it's quite clear that developing countries do not contribute too much in the area of health innovation, in particular medicines. And the reason for this was suggested in some of the previous presentations. The reason for this is that the necessary investments are not there. There are no firms with the size big enough in order to take the risks that were mentioned in developing a new pharmaceutical product, whether it is medicine or a vaccine. So the conditions are not there. So what's important to highlight is that, or in Malawi, in Brazil, or in another developing country, because the situation is different. So this would be absurd to think that the same system would work. And the evidence is there. The evidence is there that the low and middle income countries have not developed, in particular, new drugs. So we are not talking about here about education or prevention or basic science. The evidence is there. There is an interesting report was published recently by the Graduate Institute about research and development in the area of pharmaceuticals in developing countries. And then you find, among other information, that 72% of research and development in the area of pharmaceuticals is concentrated in developed countries. And then there are a few developing countries where some progress has been made, such as in China, in India, in Cuba, in South Africa to a great extent. But in most cases, this progress has been made on the basis of reverse engineering. If you look at the development of the powerful pharmaceutical industry in India, it developed because there was no patent protection. And there was a lot of innovation. There was a lot of incremental innovation in India, but it was not because of the patent protection, because of the lack of patent protection. So in the end, just to sum up, the evidence is so clear that patents do not promote health innovation, in particular pharmaceuticals development in low and middle income countries. That is very difficult to deny this point. And therefore, if we want to develop industries, want to promote research and development in these countries, we need to think of different models. Neglected diseases was mentioned, but did the patent system promote development of treatments for neglected diseases in developed countries themselves? They didn't. So this is still a neglected area, and the patent system has not worked. So just to sum up, I think that the evidence is there. Patents do not promote innovation in the area of health, in particular pharmaceuticals, in low and middle income countries. And in fact, they present an obstacle for access to medicines because they do not provide incentives, as is very clear. But since they monopolize, as it was mentioned, they create monopolies, then prices are extremely high, and there is a barrier for access, which is created. So in low and middle countries, middle income countries, the main impact of patents is to create obstacles for access to medicines, not to promote innovation in the area of health and pharmaceuticals. Thank you. I hope you could reach me. You could hear me.
The rebuttals, I just wanted to, get a few of the key elements that we've heard. So the first thing is, what do we actually mean by innovation? We heard different opinions on what innovation is and it's not. Is it just medicines? Do we include basic research? We also heard, different approaches to how do we measure innovation. So are patents a good way to measure innovation? What are the other elements that can be used to measure innovation? And clearly, we also heard this element about the relationship, whether it is causation or not, how you actually disentangle all these different variables to basically say yes or no. I was also interested to hear, the counterfactuals, so how we're comparing this against other possibilities. And of course, I do understand and agree that some of you didn't just focus on the question, but included other requirements for innovation, not just to take place, but for innovation to be used. Finally, I guess I would say it is interesting that we're talking about innovation in low and middle income countries. But of course, you also mentioned sometimes innovation for low and middle income countries. And the examples of, the different countries we heard, India, South Africa, Cuba, are, mainly not about patents, but about other ways to incentivize innovation. So I'm just trying to, put all of us together on the same page. But please, I'm very interested to hear your rebuttal. So each of you will have 3 minutes. And Anita, you'll go first. Please, over to you.
Thank you so much. And I just want to acknowledge the tremendous work that's being done in the South Center and express what an honor it is to be on this panel with all of you today here. So my focus here is going to be on this idea that we do have evidence, and I wish I had more time because we can talk about how to actually identify the impact of patents implementation with these different outcomes here. And we do have these scholarly papers that I hope we can share later where we have different ways of trying to make that identification compelling. The bottom line is that we do have evidence that patents are promoting health innovation in these countries. We've already talked about some examples, including the ones that Javier summarized. Now, if the question was, are patents the best way to promote health innovation in low and middle income countries? I think we've heard some compelling arguments that the answer is, maybe not. Maybe this isn't the best marginal thing to spend money on. Maybe we should be focusing on universal healthcare or differential pricing or pull incentives here. But that doesn't mean that the answer to the question at hand is no. The answer still has to be yes. The healthcare system that wraps around the whole patenting approach that we have had in wealthy countries, it's hardly affordable even for us. We should be innovating at the level of the system in low and middle income countries, but that doesn't mean that patents don't work. As I said earlier, we have evidence of biopharma sectors emerging, of new public health initiatives that are associated specifically with the implementation of the whole system of which patents are a part. There are problems with this system. Prevention it could occur with direct funding and not through the patent system. We know that infectious diseases are not sufficiently invested in. We know that local understandings can be exploited, that enforcement is very expensive, that old drug discovery systems designed for an industrial era are not up to date, and that Western institutions, including pharmaceutical companies, are expert in managing enforcement, and that there's other direct ways of supporting institutional change, including those that Adrian described. But if the question is, do patents promote health innovation in these countries? The answer is yes. We have significant evidence. It doesn't mean that it's the best thing to do or the only thing to do, but the answer to the question is yes.
Just on time, Anita. Thank you very much for your rebuttal. Cassandra, it's your time to, reply to everything that's been said. You've got 3 minutes. Over to you.
There, I'm now muted. I certainly hope we get another chance to go through those papers that Anita is citing. I really want to see that especially that causal relationship, because I think that's sort of the crux of it. If we're looking at this question head on, I think probably between Anita and Carlos and Adrian and I, we could make a big long list of other things that affect accessibility and that affect innovation. But the real essence of it, do patents promote innovation? Do they spur innovation in Latin American or in the world? I mean, I'm obviously fixated on one region, but the promise of patent systems to developing countries was very large. And the sort of theoretical underpinnings of that sort of idea at its most essentialist, right? that the reason why developing countries had not been able to keep up was a lack of rigorous intellectual property rights and sort of the beginning promise of TRIPS, and then all of the added, bilateral TRIPS plus agreements. And I think the perspective that you hear a lot in Latin America, other than the disappointment that it didn't magically result in a stronger system, and even the disappointment of larger middle-income countries. I remember in India, Carlos is mentioning the process patent system and how India negotiated, remember, that time period, that transition period for its firms with the idea that perhaps if it had more time to transition, its generics firms could become real global innovators. And I think in a way, it looked very promising. There were so many drugs that were in development. Big Indian companies like Ranbaxy really took to take the stage. And then when Sanchi Daiko acquired Ranbaxy, and there were so many other important acquisitions in India, I think the question then sort of became, are we just going to see a compression of this generics market in the wake of TRIPS, rather than top performing generics markets in developing countries becoming innovators themselves? And we haven't really seen that symbolic transformation of innovators emerging out of the generic sector. And we've seen, increased prices, accessibility, legal issues around bowler rights, around accessibility to data in Latin America that have limited generics markets and really kind of created that much more complicated question of the relationship between the intellectual property and accessibility, even generics. So I think for the evidence in developing countries, and certainly a view around policymakers, is that patents have provided a lot of legal complications, of impediments in terms of, even when compulsory licenses were being considered in Brazil, that seemed like such a big success in the public health community, and even the implementation of that seemed like such a big success. But even that wasn't enough to sort of ensure the long-term stability of pricing that Brazil needed. So I'll stop here and just say my biggest criticism for Anita is this idea of a causal relationship, and I think the general perception, in addition to the evidence that I showed there, is that these systems just have not resulted in much more innovation in developing countries. Even the agreements with Brazilian labs, for example, on COVID production of vaccines, when you look at the small print of it, it's pretty much all imported. Yeah, I would too. All right, are my 3 minutes up here?
Yes, just on time. Thank you very much, Cassandra.
I can't see where they're.
Yeah, no, we are on time.
All right.
Adrian, you have your chance to do your rebuttals.
Thank you. Sorry, let me just start my timer. So I feel that Cassandra and Carlos, it's great to be debating with you, but I feel you've redefined the question here. So have patents already led to significant new products being developed by low and middle income country companies in low and middle income countries, which is not actually the question that we have in front of us. And obviously, as you've rightly pointed out, the answer to that question is no. It's not the question that we have in front of us, but yes, that's no. But why might that not yet have happened? Well, Anita set out sort of one element. We're talking about time here. We've only had a couple of decades, and what Anita has identified is the early markers you might see of the numbers of patents and indicators of scientific activity are starting to increase. Second thing we've talked about quite a lot, and I tried to stress in my introductory remarks, is the importance of the demand conditions and the extent to which there's actually purchasing power there, which would enable local innovators to have a degree of confidence that someone is going to be able to buy their product at the end of the day if it works. And I think the third element is the global competitiveness. It's not realistic to expect every low-income country to develop some sort of biopharmaceutical industry. And as Cassandra, you indicated, we would certainly expect some of the middle-income countries to be able to develop those competencies. I mean, Carlos mentioned that the Indian generic industry developed without patent protection, and the key attribute, which I think Anita mentioned, was process innovation, which of course is the only thing you can invest in if you can't patent your products. Hence, India became very successful at generics and continues to be so. And then the question will be, the extent to which it's able to get into R&D based industries. But and one of the things that the piece of work that Patricia and I did was show that it's only by going for tendering from the global companies, particularly the Chinese and Indian generic companies, that low-income countries will get very low generic prices. But of course, that's at the expense of their local generic industries. So there are some trade-offs involved here. It's not say a situation that every country is going to be in a position to support a globally competitive industry. So in total, I think that if we invest in the institutional mechanisms and tackle some of the issues I've tried to outline in my introductory remarks, I think what we will see over time is that those countries where there are those innate competencies and capabilities, particularly some of the larger countries, then we will see their ability to develop products. I'll stop there. Thank you.
Just on time. Thank you very much, Adrian. And I will remind our audience that we are happy to take questions after the round of rebuttals. Please send us your questions by YouTube or by Twitter at CGDev. Or you can also, post them in YouTube. Carlos, it's your turn for the rebuttal. Over to you. You have 3 minutes.
Okay, thank you, Javier. Well, I think that what has been said, even including by Adrian, who is defending the point that patents have a positive role in promoting innovation in these countries, actually prove on the contrary, because he's referring to the conditions for the patent system to work, such as having a demand, a market, having investor capacity, and these conditions are not in the low and middle income countries. And therefore, you cannot just magically have the patents doing something when the conditions are not met. And the TRIPS agreement was adopted already in 1994. It entered into force in the year 2000 in developing countries, some developing countries even before that. And after 20 years, we haven't seen this boom of innovation in the pharmaceutical sector or the health innovation I was mentioned. So what's the reason for this? So can you actually argue that the TRIPS agreement has changed the scenario in those countries as it was promised? It was indicated by Cassandra when the agreement was adopted in a way that will actually promote innovation. It has not, and is very unlikely to do this in the short term or the medium term because the conditions are not there. I would like to see the evidence that Anita is suggesting, which does exist, about health innovation being promoted by patents, but also the point made by Cassandra is very crucial. How you can link this to the existence of patent protection, or how this causal relationship is established. This is very difficult from a methodological point of view, to say that it is because of patent that this is taking place and not because other factors or other demands that are taking place in the country. So in my view, this debate, I'm very thankful for the contributions by Anita and Andrew, but I think they have not been able to prove that patents promote or are likely to promote innovation in low and middle countries in the area of health, in particular pharmaceuticals. I think we unfortunately are in a situation in which the system does not work. So we need options. It was mentioned. We need different models in order to promote innovation in this area in low and middle countries.
Thank you very much, Carlos, and thank you all. We got a few questions for you. The first one is basically whether there's a way to make patents more effective in promoting health innovation in low and middle income countries. I mean, you guys have talked about prerequisites and conditions and changing the system. So that's the first one. And the second one is whether there's any lesson learned during COVID to respond to this question of whether patents do promote health innovation in low and middle income countries. So we'll go again in the same order. And you can answer the two questions or one of the two. Anita, you go first.
Okay, wow, these are great questions. How can we make patents better? And what have we learned from COVID? So let me just say a word about COVID first, because I think it actually has implications for the other question. So we saw during the public health emergency, the COVID public health emergency, I think the best and the worst of the patent system all at once. We saw private sector companies, Moderna, Johnson Johnson, Merck, and Pfizer, among many others, investing at the level of that was needed in order for us to get the vaccines in the way that we had hoped. And we also saw all these problems with distribution of these medicines that point to other problems in the healthcare system as a whole. So for me, COVID, I think, demonstrated how the capabilities that had developed in the private sector could be deployed for public good in a global emergency. And that unearthed, it exposed the way in which the traditional patent system leads to capability development that can be very constructive for public health. Now, the direct mechanisms, the direct line between the patent system and the outcomes is crooked. There's a lot of complications. And I couldn't agree more with Carlos that the context matters. I mean, I think what we're talking about here is patents as part of a system, and the system has worked to generate health innovations, and it absolutely has worked to generate health innovations. Patents have worked to generate health innovations in low-income countries, including middle-income countries like India, where the generic pharmaceutical sector couldn't exist without the patented drugs that emerge from other countries. So this is just to say that COVID exposed both the weaknesses and the strengths in the system. Many of the weaknesses are around delivery and access. How to make the patent system better. I think Adrian nailed it. We need universal healthcare. We need differential pricing. We need to think differently about public health emergencies and access issues. We need pull incentives. So we need to make the whole system better. And we need exceptions to monopolistic pricing. But I think it would be, we don't want to lose all of the innovation that has emerged over the last 100 years in medicines by throwing out the patent system entirely.
Okay, Cassandra, over to you.
Well, this is just so fun. Let's please do this again. But the question is not, are we throwing out the patent system? The question is, do patents promote health innovation in low and middle income countries? And so I think that is the thing that, for me, walking away from the last few years of discussion in the context of COVID, and I really like how Anita connected these questions, you see a lot of governments in the developing world, in the policy area, really struggling with where to allocate resources in a context of heightened scarcity. So I think that for governments, even large governments like Brazil, who has 7 public laboratories that have a history of 7 decades of public funding that produce important inputs in these procurement systems that Adrian mentioned, in no way has the implementation of patents in Brazil resulted, for example, in that public production being more innovative. We have not, in the sense that I do not believe that patents are what have driven increased innovative activity, for example, in farmanguinhos. I think, in fact, if anything, and it's a little bit odd, the argument, all of the emphasis on patents and all the restrictions that it has brought on local firms has caused local governments to think about other ways to invest in innovation systems. And I think that now, in this kind of a context, I think that there's so much more really emphasis on the vulnerability of the systems, on the vulnerability of the public procurement systems in the developing world, and the need for more API production, the need for stability of production. I think Adrian really mentioned it, and I've looked very closely at procurement policies, for example, in Brazilian laboratory systems, and it's exactly right. They're buying APIs from global producers, and they have to buy them at a certain price level, and then they're very poor quality, and then they receive them and they have to throw them out, and then they have to buy another batch. And all of these sort of basic questions of procurement and quality control have a big bottom line issue for public procurement systems that really need to gain more access to basic pharmaceutical inputs and increase innovative output, but in no way have been spurred to do that due to a hardening of patent systems in their countries. If anything, it's just spurred thinking about how to work around those systems. I could see that argument, but it really has been a limiting factor, and I think that it doesn't mean that it has to all be thrown out, but certainly the extension of patent rights across Latin America, across the world, has had an impact that has in some ways been negative, and it's just very tenuous to think that it's again, I hear Anita speak about something that I think is really interesting and true, which is that it's the power of pharmaceutical innovation in the private sector, as she said, harnessed by public coordination and infrastructure, and that could be harnessed for public good. And I really believe that is a story for developed countries and for a few exceptions. But for a large number of developing countries, accessibility to quality vaccines has really been challenging and persistent.
Thank you, Cassandra. Adrian, answers to the two questions, please.
Yeah, thank you. So making patents better, I think I'll just focus on the sort of global purchasing and the role of product development partnerships, and whether any of that money and those initiatives could potentially involve more of the science space and emerging entities in some lower and middle income countries. But it does seem to me that the getting the access to purchasing power for me would be the way of making patents work better for these countries. And the second question was about COVID, and as Anita said, it highlighted the way in which patents can incentivize R&D. And indeed other related things. So the first COVID vaccination I had was the AstraZeneca Oxford University vaccine. Oxford University developed it, and we don't have time to get into the pull initiatives that led to that. But the UK government insisted that AstraZeneca partner with them to commercialize that in order to get the benefits of a global pharmaceutical company. Why did we end up with unequal distribution of the vaccine? Well, simply because the bigger, richer countries refused to participate in COVAX and an advanced market commitment that would have involved a lot of initial supplies not going to larger countries. I mean, we did, for example, see within Europe, the European Union, there was agreement to pool resources. And in fact, for example, Germany and France, who could have outbid other European countries, didn't. And so there was a more equitable distribution of vaccines within Europe, but unfortunately not between the North and the South. So I think the key issue really for me was not the patents. It was our unwillingness of countries with more money to recognize the needs of countries with less money. I'll stop there. Thanks.
Thank you, Adrian. Carlos, any answer to these two questions? Or
well, yes, thank you. You can't see me still. Huh? I think it's the camera has some problems. But concerning the first question, how to make it more effective, how to make patents more effective, I think this question is wrong because the patents are not effective. So you cannot improve on something which is not working for low and middle income countries. The suggestions made about differential pricing or pool incentives, these are not part of the patent system. So this actually shows that you need something else if you want to promote innovation in different contexts, because that particular system does not work. Regarding the second question, I was quite surprised by the reply by Anita, because she said that they were able to create public goods, but interestingly, they made huge profits on private goods because vaccines never became public goods. They were never made available. These companies refused to transfer technology to other places, entities in the South, in order to develop their own vaccines, as it was the case for the mRNA hub in South Africa. There was a refusal to transfer technology. So quite clearly during COVID-19, the role of patents as an obstacle to expand rapidly manufacturing capacity became quite evident, and this is why the so-called TRIPS waiver was requested in WTO. It was finally given in a very late, and in a very narrow manner. So the point made also forgets that Moderna and other companies received massive subsidies to develop the vaccines. They didn't develop because of the incentive provided by the patent system. They did work on the basis of major subsidies given by especially governments and some philanthropic institutions. And just to make a last point about what we are discussing about low and middle income countries, if you look at the TRIPS agreement, Article 66, paragraph 1, this article in the TRIPS agreement has provided a transition period for least developed countries on the argument that in order to develop their technological capacity, they need to be freed from patents and other intellectual property rights. So this was recognized by those who developed the TRIPS agreement themselves, including developed countries. So these countries still are under the transition period, and they don't need to recognize patents, in particular pharmaceuticals. So I think there's a clear message given by the international community that what we are talking about now is clear in the sense that developing technological capacity will need a system without patents in order to allow that to happen. The patents will not promote such a development, as stated very clearly in Article 66, paragraph 1 of the TRIPS agreement itself.
Okay, well, thank you very much. I think we've had a very good to and fro, but it's the time to wrap up. You guys all have the opportunity to make your closing arguments. You have up to 3 minutes each. And you can, go back to your original arguments, pick anything that you want from the conversation now. And I think I want you all to close with what's your key line, your takeaway message for our audience. And of course, we want to answer the question that we posed, which is, do patents incentivize health innovation in low and middle income countries? But if you have any reflection, listening to what you just to everything we've been through, that would be great. So Anita, please.
Thank you very much. It's been such a pleasure to be with you all today here. And Javier, if I'm correct, I think the question is, do patents promote health innovation in low and middle income countries, right? It's not about incentives. It's about whether patents are actually promoting health innovation. Is that correct?
Correct.
Okay, great. So look, I mean, there are problems with the patent system. Boom. I mean, there's no question about it that the patent system was invented at a point in time. It was implemented at a point in time and extended in the early 90s at a point in time at which we faced certain ways of thinking about producing medicines that are now known to be antiquated here. And patents, the patent approach, the approach that's associated with patents is one of privatizing intellectual property in order to create those incentives. And the question is, does the patent system, a system of privatization of incentives, to produce intellectual property that can manifest in health innovation? The answer to that question has been incontrovertibly yes, and thank goodness for that. I mean, who would want to live in a world without the medicines that have been developed for many of the diseases that are prevalent in low-income countries, including cardiovascular treatments treatments and vaccines, preventative treatments for neglected diseases. So we're seeing innovation in low and middle income countries that is associated with the whole system of which patents are a part. I have many examples, including from the countries that Carlos mentioned, of companies entering low and middle income countries because of the assurances associated with harmonized patents. Is it the best we can do? Probably not. Does it work? Yes. So please vote yes in the final poll. Thank you.
Thank you, Anita. Cassandra?
I want to really, again, also thank everyone for this. And it's so important to have the chance to air out ideas and to do our very best to take them to the logical endpoints. And I think that that was the idea of this conversation. And we all recognize that within that spectrum, there is a lot of gray. When I hear Anita and her robust defense of the patent as a promoter of innovation, I do applaud that and agree with that on one level, in that the papers that I've brought forward and that I cited to you all show that it is possible that patent systems have positive and gender positive effects on innovation systems, that folks see the capacity to own, their products, and that incentivizes their innovative behavior. Except for that the data we have indicates that only works when a country has reached a certain income level. And it's difficult empirically to point at exactly when that magical moment happens, why high income countries perform so much better in things like economic complexity index when we run those variables and we look at and we see, is that improved? Things like total factor productivity, is that improved? Across multiple ways that we look at how patent systems interact with economies, we see that it's natural. Systems, countries that already have complex innovative systems, that already have highly educated folks working in the field of science and technology, are really able to reap the rewards of those formalized systems. So I'm willing to concede that patent systems are helpful in innovation systems, and I'm willing to concede even that they've spurred innovation in developed countries. But I think really what we're looking at right now in this conversation is the disappointment and the lack of how those have transferred to more innovative output in developing countries. And there are exceptions to that. There's biotech sector in Argentina. There's interesting things that are being done in South Africa. Of course, there's always India and China. So I think together we're looking at that in a way here from different angles, and we're saying, what are those pieces that strengthen those patent systems, strengthen those innovative systems? I'm willing to say that patents are part of those, but I think that it would be far too much to concede or far too much to say that patents themselves promote innovative output in the health sector in developing countries. I look forward to future conversation with everyone on this.
Great. Thank you, Cassandra. Adrian?
Yeah, so again, I would just remind the question is not, have patents led to thriving biopharmaceutical industries in all low and middle income countries? It's are they part of a jigsaw that's going to lead to more innovation coming from low and middle income countries? And I think Anita set out a number of the sort of aspects and elements, and in particular that we're starting to see the fruits in terms of science and other sorts of initiatives. But the critical thing is that we need purchasing power from one form or another. And I think Carlos said, well, that's not about patents. No patent system or any, I would argue, any alternative to patents can stimulate R&D for successful development of products if no one's going to buy them, if there's no money to buy them. And that's absolutely crucial. And that can't be done in a national system. In order to encourage a competitive science-based biopharmaceutical sector, they have to be able to sell their products in more than one country. And in order to do that, there has to be some sort of patent system that means that they can get a return in other countries and not simply have their innovations copied and the R&D exploited and to get no return. So it does seem to me that that's an absolutely crucial part of the overall system. And we haven't heard a lot, it has to be said, from Cassandra or Carlos as to what the alternatives are, and in particular, where the purchasing power comes from. And if there is purchasing power, why that can't be used to stimulate more innovation through the patent system. I'm conscious of time, so I'll stop at this point. Thanks.
Great. Thank you, Adrian. Carlos, you have the final opportunity. Please go ahead.
Okay, well, thank you very much. I would also like to live in a world. Anita said that who would like to live in a world without the medicines that were developed? But I would like to live in a world in which medicines which are developed are accessible to the people. And because of the patent system, they are not in many cases. Just take the case of one medicine for spinal muscular atrophy, which will cost in the United States 2.1 million one dose. In my own country, it will cost $300,000 US just one dose. So it's good to live in a world where there are medicines, but where are medicines which are accessible. So the patent system may promote innovation in developed countries, but it does not promote access to the innovation, and this is a major issue. So I think Adrian has now mentioned that the very intent of the patent system from the perspective of developed countries to ensure that the drug developed in an industrialized country can be sold in a developing country. So you just create the monopoly there in order to sell the drugs, but this has nothing to do with promoting innovation in low and middle income countries, which is the question that we are addressing. So thank you very much for inviting me to this debate. It has been extremely stimulating. Let's hope to continue this dialogue, but in particular, let's talk about if the system is not working, as Cassandra and myself are arguing, what are the alternatives? How can we actually promote innovation in low and middle income countries? If this is true that, well, I think the evidence is there, the system is not working. So what else needs to be done? And in fact, you have DNDi, for instance, a philanthropic institution has developed important medicines, not relying on the patent system. So there is a lot to be discussed, but thank you very much again for the invitation.
Well, thank you all very much. It's been a very good conversation. And I just take away this comment that this is not it. Like we only had a small part of the whole puzzle. And we're talking about not just alternatives, but also innovations in and for low and middle income countries. So thank you all. Very stimulating conversation. We take up the challenge on following up on some of the issues. But let's have the final poll. So please, if everyone can then scan the QR code, include the number and vote, we'll see whether, we've changed, people have changed their perceptions about the question, do patents promote health innovation for in low and middle income countries? So let's have the numbers in 30 seconds. Please do vote. Remember that we had 60-40 and we had 60 going for no and 40 going for yes in the initial poll. Kate, please, what are the numbers? And thank you all very much for joining to this CGD debate. We think it's a very interesting new way to discuss contentious topics. So now we have 42% for yes and 58% for no. So I guess we are exactly in the same place where we were at the beginning. People were not convinced of any of the arguments put forward, or maybe we got, again, all about measuring bias. We don't know whether the universe is the same because we might have more people now than at the beginning. In any case, it's been a pleasure to talk to you all. It's been a pleasure to hear the arguments pro and against. Thank you all very much. Take care and have a good afternoon.
Bye-bye. Thank you.
Bye-bye. Nice to see you all.